This will be a patient assessment for the cardio emergency. So you're going to go dispatch to some type of patient probably having chest pain. So you're going to respond there. Uh, First thing you're going to do is make sure the scene is safe. Look for anything that may be a danger to either yourself, patient, or bystanders. Make sure that it's taken care of before you approach the scene. Once you start approaching it, you're going to do your BSI, body substance isolation uh, procedures. You're going to put on your mask, especially this time of in history with the coronavirus, and then also your gloves to make sure you protect yourself from any type of fluids that might be involved with the patient. So once you're there, there's a number of patients. You have one patient. Let's say it's a 50-year-old male having heart issues. So you're going to determine that you only have one patient. I would say, based on the fact that we're EMT level, we're going to want to get ALS rolling right away to assist with the very least patient intercept. So general patient impression of the patient, depending on the type of emergency they're having, usually something is not right with the heart. It's not able to pump properly. It's not getting enough blood to it, and the heart is starting to shut down. So they might not be visually responsive, but they should hopefully be at least somewhat audibly responsive to you arriving at the scene. So you're going to determine, you get your general impressions. There's a male, hopefully they're sitting down, or if not, have them sit down and try to ease the pain as much as you possibly can. And hopefully when they sit down, the pain will be somewhat suppressed. So then once you get done with your general impression, your chief complaint is going to be the chest pain. It may be radiating to other parts of the body. They'll tell you that. So then you got your chief complaint. Then you're going to go into your ABCs, which is airway, breathing, and circulation. So you can make sure the airway is patent and open. Make sure the breathing is where a proper rate where it should be. Make sure they're getting enough oxygen in, which if they're having a cardiac emergency, they may not be. And the circulation, you're going to want to check the blood pressure, make sure it, you check the skin and everything, make sure it's proper color, which will tell you that there's either proper or improper circulation. In this case, there's most likely going to be improper circulation. So you're going to get the history of the chief complaint. What was the cause? Well, it could be something where it's induced by strenuous activity. Otherwise, it could just be a sudden onset. Like I said before, hopefully once you sit them down or get them laying down in the bed in a semi-supine position, that will hopefully ease the pain a little bit. Ask them about the type of pain. Is it, in this case, it might be like a crushing feeling. Ask them if it's spreading anywhere. With a cardiovascular emergency, it might be spreading from the main area out to the extremities, such as arms or legs. And how long has the pain been there? It could have been there for 20 minutes, hopefully not that long, while EMS is arriving. And on a severity of 1 to 10, how bad is the pain? So they may say it's like a 7 or 8 with the being the worst pain they've ever had. So then you're going to get the medical history of the patient, get the signs and symptoms of what's going on with the cardiovascular emergency. It's going to be, signs that you might be in a tripod position from the chest pain when you arrive. Once again, you can proceed. Hopefully that alleviates pain. Ask them if they have any allergies that they know of, just to make sure there's no allergy to any kind of medication you might be getting. Ask them if there's any type of medication they take currently. When was the last time they ate? Because you want to make sure that might not be like a food allergy or something like that causing the pain. And what events led up to it. Either it could be a strenuous activity, or if it's just a sudden onset to do medical history, which you also find. So at that point, you're going to, if they have the chest pain and it won't go away, touch the chest, make sure the pain isn't worsened by touching, which it shouldn't be if it's a true cardiovascular emergency. At that point, you're going to administer both most likely nitroglycerin and aspirin. You're going to give 0.4 milligrams of nitro sublingually under the tongue in either pill or spray form. And you're going to give the 324 milligrams of aspirin to make sure the platelets aren't coagulating, so make sure that the blood can flow through the body freely. Before you do that, though, you're going to want to make sure that they don't take any pills for, like Viagra, like erectile dysfunction or anything like that, and make sure that they haven't taken the nitro before you got there too recently, just because you don't want them to be too hypotensive. So you're going to do your head to toe exam, starting with the cardiovascular system, which is the heart. Check the skin again, make sure it's good. Make sure they don't have any like GI issues or anything like that, with no GI bleeds. Make sure there's no visible bleeding of any type. Make sure they don't have any like tenderness in the spine or spinal injuries. And make sure there's no other like broken bones or something like that, where you got a skull fracture or something that was going to hurt even more. Obviously, you're going to try to get this person loaded up into the ambulance and transported as quickly as possible with the assistance of the ALS. Once you get to the ambulance, you're going to take the vital signs and do the pulse ox, the pulse, make sure that they have a decent heart rate. Hopefully they will after you administer the nitro and the aspirin. Check the blood pressure. Make sure that the nitro and aspirin didn't drop the blood pressure too low, because you need your 65 level map for the proper kidney function, other organ functions to be filtering everything. Make sure that they are still responsive to some type of stimulus, hopefully visual. Hopefully they can track you with their eyes once you're in the ambulance and follow what you're saying. Check the skin for color. Check the pupils, make sure they aren't too dilated, and make sure that they are dilating equally and reacting to light. Check your lung sounds, your breathing. Make sure it's not like something where the blood is pooling up in the lungs or something like that. It's going to be even worse situation for you. And then get your ETCO2 also administered to make sure it has proper oxygenation of the blood and the air they're respirating. As you're going through the hospital, just keep evaluating them, do the head total exam, check the vitals, and just make sure that and just keep asking them, is the pain getting better? Is there anything you noticing the pain coming back? And then you're going to want to turn them over to medical staff, let the medical staff know any type of treatment you did, and then make sure you pass on to a higher level of treatment or care at the hospital.